Okay, good afternoon and welcome to the Data, Culture, and Assessment webinar. We'll be going until 1:15 p.m. today. Just some housekeeping items before we start. Audio is available through your computer, and if you can't hear the webinar, please use the phone and dial in. The information is in the orange box on your screen. Abel, would you be able to change the slide? Thank you. Please use the questions or comments in the chat box of the GoToWebinar, and we'll be answering your questions throughout. The presentation and handouts are available to download through the GoToWebinar window as well. Next slide. So today's objectives are to compare and contrast the data used in quality improvement and performance measurement, introduce E-QIP integrated assessment tools, define data culture and share the culture of data use self-assessment for agencies, describe how a data assessment can be used to inform quality improvement, and lastly, to share resources to help advance your agency's data culture. So let me introduce myself. I'm Amy Patel. I'm a program manager for E-QIP, working alongside AMHO and CMHA. And today I have with me two of my colleagues, Alex Clement, who's a quality improvement coach at E-QIP, also at CMHA Ontario, and then Abel Gab, who's a data coach for E-QIP, working on the AMHO side. So E-QIP is the Excellence Through Quality Improvement project, which is a quality improvement initiative focusing on the leadership and capacity building, and it's led by AMHO and CMHA Ontario, and it's delivered in close partnership with HQO, soon to be Ontario Health, and PSSP at CAMH. The project promotes and supports the use of evidence-based assessment tools to do quality improvement and aims to improve the mental health and addiction care in the community. So we achieve this vision by increasing the understanding and the use of quality improvement methods in mental health and addiction care, increase data literacy, work towards improvement in key domains of quality and spreading promising practices, and lastly, supporting a culture of quality improvement, learning and mentorship across the province. So here's the model for improvement, and the model of improvement looks at what we're trying to accomplish, how will we know that the change is an improvement, and what change can we make that will result in improvement. So this model goes through the PDSA cycles, and we look at the 6 domains of quality: safe, client-centered, timely, efficient, equitable, and effective. And this is also linked to the quadruple aim, which looks at improved patient outcomes, lower costs of care, and improved provider and patient experience. Now I'll hand it over to Alex.
Thanks for that, Amy. So as Amy mentioned, my name is Alex Clement, and I'm a quality improvement coach with the Excellence Through Quality Improvement project. And I just wanted to take a couple of minutes during our webinar today to speak to what it is that data has to do with our work, especially in the current kind of context for mental health and addiction sectors. Next slide, please. So as folks are probably aware, there's been a bit of a shift, or a lot of a shift in sort of the way that healthcare and mental health care services are going in towards of a future directives, including the creation of Ontario Health as well as Ontario Health Teams. Now, whether your organization is currently part of an application for an Ontario Health Team, or it's something they'd like to pursue in the future, or maybe not even something that's necessarily on your radar at this time, the ministry has indicated that there are sort of 8 priority areas or foundational building blocks that are going to be used to determine sort of the performance, the measure of success and outcomes of Ontario health teams. So keeping that in mind, these priority areas are definitely something that should be on everybody's radar. And if you look to the top right-hand corner, you'll see performance measurement, quality improvement, and continuous learning identified as one of those key foundational areas. Next slide, please. For those that may just be new to quality improvement and maybe not so familiar with performance measurement, the idea of quality improvement itself is that it's really a continuous and systematic approach to making changes that improve quality of services and really lead to better client outcomes and stronger system performance. It's all about looking at our services and systems and processes as they are and taking them from good, better, to hopefully eventually the goal being best, but realizing that it's a continuous cycle that's always going on. And it really draws on the combined efforts of all stakeholders, which includes the service providers themselves, clients and families, researchers, planners, educators, you name it. Anybody that really touches that system is crucial for helping make those better and sustained improvements over time. Next slide, please. So this contrasts a little bit from performance measurement, though quality improvement and performance measurement are often lumped into the same category and sort of considered to be the same thing. They are distinct, though related to one another. So performance measurement is really about assessing the degree to which services achieve desired outcomes. So it's talking about collecting data on a regular basis to analyze whether services, processes, and systems need support in planning, management, and quality improvement. So performance measurement really keeps a pulse on activities and is continuous measurement to help inform planning, management, quality improvement. So it can also be used for accountability, funding, and provider payment purposes. I'm sure people are familiar that we report back to ministries and funders on a regular basis, and they use those metrics to kind of see how it is that we're doing over time. Next slide, please. So where the two performance measurement and quality improvement sort of link is that performance monitoring identifies gaps between our current performance and our desired state of performance. So when you look at this gap or this discrepancy between current and desired, those can be areas that become a focus for quality improvement. We can also talk about benchmarking, helping establish performance targets and quantifying the potential for that improvement. So saying, okay, if we have a current performance of X and we're hoping to get to Y, we can set that target and see kind of the degree of improvement that needs to happen for us to get from that current to desired performance. So again, the ongoing performance measurement can help us track that improvement over time. So whether you pronounce it data or data, it kind of comes into play for two of these key processes in a variety of different ways. And if you look at the table on the screen, it sort of demonstrates how the data use in quality improvement and the data use and performance measurement are a little bit different. We've got kind of the aim, the bias, the sample size, etc. And I won't go through all of these, but the one I really wanted to point people towards is the top one being the aim, where we talk about data for quality improvement being used to identify areas where we can improve those care processes, systems, and outcomes. Whereas when we talk about performance measurement and accountability, it's really to help us do some quality assurance, maybe keep an eye on how things are going over time, and eventually spurring that change if we see that our performance measurement isn't really at the desired state that we'd like it to be at. Next slide, please. So now that we've kind of talked a little bit about data and its use in our current context, it might be worthwhile to talk a little bit about data governance and data culture, which are two terms I think more recently have kind of become these buzzwords that are still a little bit vague in that they get used a lot, but people may not necessarily have a really good understanding of what those two things point towards and how they may be different or related. Next slide. So when we refer to a data-driven culture within an organization, it's really to point towards an environment within that organization that seeks to leverage data whenever and wherever possible in an effort to enhance service efficiency and effectiveness. So really going back to that quality of our services, processes, and the system overall. And when we think about data and sort of boil it down to the smallest unit, it's really about information in a raw or unorganized form that refers to different conditions, ideas, or objects. And really, I think if you take anything away from this webinar today, it's to start considering data as an asset. Next slide, please. So when we talk about a data-driven culture, there's really three fundamental elements that help create that culture. The first and foremost being mindset. So really setting the stage for the culture and creating an atmosphere where data is a topic that's brought up and really sets the expectation for how data will be used. So we also suggest that, when you're keeping data in mind, it's about having that improvement lens within your services and systems and making sure that it's aligned with the quadruple aim and domains of quality that Amy brought up earlier. The second piece, of course, being the skill set. So once you've sort of created that culture and that conversation around data and its use, you really want to provide all staff the skills to be able to utilize data. And it's often referred to as data literacy, and that's just the ability to read, write, and communicate data in context. Once organizations sort of have a handle on the mindset and the skill set, the next step should be really look at the tool set and ensuring that the technology that you have within your organization, whether it be electronic records or other methods of collecting information, that it supports your current data culture. So the tool set will never replace mindset and skill set. It's really just there to help kind of embrace it and sort of get it to give us the tools to help collect the information that we're hoping to have. And you really need to remember that culture is everyone's responsibility, and data should be embedded into all activities and conversations. A lot of the time we have frontline staff that don't necessarily see their role in data, but kind of, again, creating that culture and starting those conversations about how data can be used to inform everyone's work. Next slide, please. And when we're talking about data culture, it also helps to have strong data governance, which would be the overall techniques, tools, policies, and procedures that guide the management and transformation of your agency's data into actionable information. So long gone should be the days of one person in an office creating a really complicated report based on all of the agency's metrics over the past year or quarter, and it's kind of getting printed out, stapled together, and thrown in a binder somewhere where it's not really used in an actionable sense. We really need to keep in mind that when we use data, it has to be done so in a way that is contextual and is understandable to people. So when we have good governance or data governance in place, it should really improve the overall quality of data that's being collected and used and reported on, as well as increasing data literacy for all staff in all positions throughout the organization. Again, being that literacy being that ability to collect, understand, and interpret data, and as well as maximizing data access. So again, it really shouldn't be the responsibility of one dedicated data person to sort of manage or be able to find information. It should be available to everybody that can use it and benefit from it. Next slide, please. So to just kind of drive the point home, we've got a list of activities here that data is really crucial for. Everything from improving quality to maintaining quality assurance, which is often linked to accreditation, finding solutions to problems, which could be referred to as root cause analysis, allocating resources efficiently, informing decision making, and identifying strengths and areas of opportunity throughout the organization. And I'll get you to advance the slide. So really, in a nutshell, you can't make good decisions with bad data. So data is really crucial for our decision-making process and for helping us sort of tell our story and learn more about our own performance outcomes and how our services and processes are doing. Next slide. So I'll actually take the opportunity now to let you kind of marinate in all that information about data culture and data governance, and just open up the opportunity for people to ask some questions. You can use the question and chat box in the GoToWebinar meeting panel to type us a question and let us know if you have any thoughts around what you just heard, or any questions or clarification that would be helpful. So we'll take a couple of minutes to do this. Okay, and hearing no questions right off the bat, I realize I may have jumped a little too early to those. You may still, again, be marinating in all that information about data culture and data governance, but please, if you do think of anything, feel free to pop it into the question or chat box, and as Amy mentioned, we'll be able to answer those throughout the session. So I'm actually going to pass it over to my colleague, Abel, and he can go through the actual data assessment with you.
Thank you, Alex. My name is Abel, and I'm data coach for E-QIP project, and we're going to see the details about the assessment tool, the assessment tool. So basically, the tool is mainly about highlighting the strengths and identifying any challenge the team or the organization might have in implementing data-driven QI projects. So most of the time, we don't realize what our strengths and blind spots are, because we're really focusing on giving services to our clients, right? So probably there is no time to step back and see what's out there other than the given atmosphere. So this tool is about offering the opportunity for teams to see themselves with the lens of the questions listed in those three categories, data, QI, and sustainability. Although it's prepared in relation to QI projects, but I would say the tool is an opportunity even further than QI projects. So it can be paint a good picture of what is out there beyond QI projects or projects. So in terms of the background, in the past 3 years, just to give a background for why we're doing this, when we work with different teams, small, mid, or large organizations, we've been experiencing and seeing different capacities in data, QI, and sustainability areas, right? Some mental health and addiction organizations have high readiness in terms of data and quality, which is a great advantage to their sustainability. Others, there were some challenge to identify even the issue from the get-go and having a solution to those challenges. And still others, it was difficult to even start any QI work because mainly such organizations' readiness and to implement data-driven QI work that can sustain beyond the project life cycle. So the reason behind to prepare this tool is such experience in the past, and now we can say we have a formal tool to address this issue. So for today, we're going to focus only on the data assessment, and hopefully you're also registered already for the next webinars to see the QI and the sustainability areas. But just to mention it in here, the sustainability tool we adopted from IHI, Institute of Health Improvement. They have many great QI tools and literature, and this was one of it. So we adopted it in the past. So it's going to be covered in detail in the sustainability. So again, from our past experience, we can identify 3 top data challenges and other top 3 data enablers. And the most common challenge is a lack of standardization, which means mainly inconsistent of data entry. In some cases, even if there is a massive data in the system or in the data collection system, there is still lack of access to reports. And with others, there is lack of expertise and support to generate data as well. So we've seen this challenge. On the other hand, for those who really were successful out of QI projects, their willingness to change for new ideas and processes, or for others to have available measures already, and still others who made significant investment and prioritization of resources to upgrade their data capacity are some of the highlighted observations. So in relations to this experience, having such assessment tool is a formal way of telling the actual capacity to identify early on, either to use the resources still not used, or to invest in making data at the centers of services. So this is a screenshot from the assessment tool, which we call it Integrated Data Quality and Sustainability Assessment Tool. It looks like this. This is the first page. So far, it has 6 different pages. And the first page is the guidelines page, as you can see it in here. Second page is pre-assessment, which means before the project starts. And the third page is the post-assessment, once or at the end of the project. And fourth is the summary page, then the action, and there is also a planning page. So basically, it analyzes methodically the current state to identify blind spots and strengths within this integrated approach. You can say also it's a roadmap from assessment into action and beyond. So the guidelines is a page that gives practical step-by-step instructions and detailed descriptions about the tool. So in the pre-assessment page, as well as in the post-assessment page, one of the assessments is, so the assessment page has 20 questions divided into 4 different major categories. We will see in detail what those 4 categories are in the next slides. Just to give you a highlight about this data culture assessment, basically, as I said, it's a navigation tool. So, and the pages are interlinked to each other. So whatever the values are in there, you would see it in the summary page as well. So we'll see in detail later on as well. So the first part of the data tool addresses the policy question, and it asks questions: how is the policy in relation to data collection and dissemination? Asks questions like, if there strategies specifically addressing data governance, and if there is a data strategy that's addressing different levels of the agency. It asks questions like, do the leaders encourage staff to generate data and evaluate programs? So do you have clear policy to prioritize data and its use among staff? So asks different questions, and you would assess and give the value to each questions. So basically, without a policy that encourages data use across organizations, the culture of data based on data-based meaningful improvement work has little success. So the next area the tool assesses in the data use culture is how is data practically used in the organization. In this area, questions like for every service, event, and activity, is data collected consistently? Is data collected by both managers and frontline staff on a regular basis? Do you offer training for new staff on data entry and data use? Is the data entered on a timely basis? Are staff given the opportunity to have a refresher training on the data collection system? Those kind of practical questions, because even if there is a policy, but in practice, how is data being treated? So having a policy is not enough. It is data, because data should not be a burden. So it's going to assess whether the data is a burden or a facilitator. So this would give an opportunity to see all these areas. The next category is exploring whether there is already data products within the team, or if there is a need to design a new one. So in this area, there are questions we need to answer in terms of, are data reports generated and widely distributed to staff on a regular basis? Our reports are consistently discussed at staff meetings? Are there folder or any other form that staff can save or access reports? Are there templates the staff can use to generate data? Is there a capacity or a mechanism to query data to satisfy the agency's needs? Those kind of questions, assessed or discussed in this category. Because experience of many small or mid-sized organizations is that they have a lot of data, but if there is no any measures or templates or queries to disseminate or use the data, and that's a little bit an issue. So it's going to assess this area in this category. And the final piece of the data assessment tool is exploring about the human aspect, because without dealing with the human aspect, even if you have the policy, you have the base tool, or you have all the the templates, but if you don't have the staff, if you don't have the human aspect of the data culture, it would be an issue, right? So the human aspect of the organizations is going to be covered in this area. So we are going to answer questions like, is data collection done by all the staff? Do staff collect and enter data on a regular basis? Do staff use data to support the services? Is the services is based on data, the data that we use? Do managers and the staff discuss what data should be collected? Those kind of things. The human aspect of the data culture would be discussed and assessed in this category, because are the right people in the organizations to collect, analyze, and disseminate data are there, and we have to have people to generate knowledge out of the information that's being collected. So Once we answer all the assessment questions, we're going to see the summary page. In the summary page, you would see your results as a summary. We will see this how it works, but in general, this is a page to see the clear picture of where we should focus and where we see our strengths. You can see by looking at it, then you might say, hey, we knew we were doing great, but we didn't realize how great we are, right? So it's not only about to feel bad, but to celebrate as well. So or you can say, there is an opportunity to work on these areas, and there is an opportunity to be a little bit better. So there is this kind of discussions once you see the summary, or you might even say there is resources and capacity to do this. So, but we need to put this as a policy and see it in a practice. So, but by looking all this summary page, you can say something in terms of your data culture in the organization. So the summary is a good way to see the picture of yourself in a mirror. So the next question you might ask once you see the results in the summary page is, okay, then what should I do now, right? In other words, then what? So it's one more step further to give you suggestion item by item or question by question. This is just a suggestion or recommendation. So it's not by no means it's a medication to any issues you might have or the organization might have in this area. Of course, there is a lot of variety or variation in different teams or organizations. So taking into account your uniqueness, I think it's important, and that's why I say it's a recommendation, not a solution or an entire solution. So it's good to understand organizational uniqueness. So it cannot be 100% solution. That's what I'm trying to say. So, but however, this can help in figuring out what you can do once you know the results, right? You know your team, you know your organization better than the tool. So you can say, okay, this is a good suggestion, but I will do it this way instead of this way. You can say that. We cannot leave you just only knowing your results. So this is a tip to be a little bit more practical. The suggestion is used if you have a score of less than 2. We'll see it later. How it works means below the middle line, or if you see red color in the summary page, you can use the recommendation. So obviously, if you're doing good, or if you have a score of above 3, you don't need to use the recommendation. So this is also another page, the planning page. And so this is to document the planning in order to work on the recommendations. So there is recommendation there. And I think if you wanted to go beyond that, and if you wanted to plan, this is the page that you need to record it. So it gives you an opportunity to plan and follow up. You can aim what you're going to do, when and seen in a month or 6 months. What have you done so far? Those kind of things. So basically, it's an action tracker. So we try to make it a smart plan with follow-ups. So you can adopt as well. So now we'll see how the tool works. I'm going to change this into Excel file. So this is the assessment tool, and as you saw in the screenshots in the PowerPoint, so it all details the definitions, when this should be done, or what the summary looks like, the action, all these details are in here, and it gives you guidelines on how to fill the form. So the pre-assessment is in this page. So in this page, you can have all these 3 assessments, but again, as I said, we're going to focus on the data culture for today. So you would see all those questions. And by the way, you're going to have also a supplementary questions, a list of questions to match with these questions. So you're going to have a different set of questions to understand more in terms of what the question is saying about, right? So, for instance, the first question, we have a well understood data use strategy that outlines expectations for data use at all levels of the organization. So, as a team, if you agree on this one, or you strongly agree, depending on your answer, let's say for now, let's make it agree, right? So it automatically it gives a value into it. The next senior leaders in our organization consistently use data to support in decision making. Probably if you don't agree on this one, strongly disagree, right? So you can feel based on, again, this is extensive discussion within your team, and the guidelines, it recommends who should be in that kind of discussion. So it's better to reflect a team opinion than a 1% opinion for the organization. So yeah, so before that, sorry, let me see the summary. Well, right now we're filling right now, but it should be just blank like this one. This is a post. So as soon as we fill those, or we enter the data, and the summary page would give you different colors. Yeah, so this is a pre-assessment, and then by looking at the colors and the values, you can say, okay, so we're doing good in this category or in this question. You can say, but there are opportunities, for instance, here. So for instance, questions like, for this one, accessibility of reports, real-time reports, those kind of things, we have a value of 2 or below, as well as this one. So these are the recommendations for. So with the other ones, you can just ignore it, or you can just keep doing it. But for the values that you have 1 or 2, you can go back to the and then see what you can do based on the recommendations. So once you fill this one, and then again, this is before the project, before you start the project. And then after the project completion, you can do the same thing. So let's see how it works. Again, this is a team exercise. You do this within your team with extensive discussions, and you see now you can compare between the pre and the post, whether you improve during the project cycle, if you do something to improve those areas. So you can see the results as well. So this is a summary based on the pre and the post, and this is the recommendation. So for instance, for the policy, right? So question by question. So for instance, for strategy, so I recommend to design data use strategy, share with staff, collect feedback from staff if they are aware of the strategy. If possible, include some questions to the annual staff survey if they are aware of the data strategy of the organization. So that is the recommendation if you score 2 or below, right? Again, you can use your own solutions. This is just, again, a recommendation. So there are recommendations for each questions, detailed kind of recommendation. And as I say, the next page is the planning. So you can plan. So it shows here actually the score as well. So action needed. So it's a drop-down list, whether it needs an action or not, yes or no. You can say yes or you can say no, depending on the score. And yeah, so you can fill in then priority level, what's the priority level, whether it's urgent, normal, low, and who is responsible, who's going to do these things, responsible person to organize or to do something about it, by what date, and 2 months follow-up date, and next steps as well. And then even after 6 months as a follow-up, and then next step. So it gives you all the detail fields to put the the necessary actions in there. So I think basically this is the tool, and I think hold on. Let me go back to the slide. Yeah, so basically the data quality and sustainability assessment tool is it's a CAP tool. It's a knowledge, attitude, and practice assessment tool. Again, as I said, this is not to make one feel bad. Rather, it's about one sees oneself in a mirror, right? So the tool, as you saw, it takes you from exploring the aspect or the item to the action and planning to improve what you see in there, right? It's also a tool for celebration as well. It's about celebrating one's success and achievements, and celebrate one's investment so far. So take this opportunity and let's work together. Thank you. And if you have any question, before I think I'm.
Thank you, Abel. I think that was a really great overview of the tool that E-QIP's kind of put together. And of course, giving credit where credit is due, we've adapted this tool from a variety of other sources across, like throughout quality improvement, as Abel mentioned earlier, places like the Institute for Healthcare Improvement, the National Health Service over in the UK also has some really great tools. So when we as E-QIP coaches use this tool, it's really to start those conversations around data culture, quality improvement readiness, and sustainability. So I actually saw a really great question pop up in the question box, and I'll just read it now and then kind of take a stab at trying to answer this. So based on recent experiences as an agency, they would have scored abysmally low across the board. So when that is the case, how do you select the starting point and identify interim goals to improve the data culture? And I'm going to take a stab at this, and then I'm going to pass it over to Abel so he can add his data perspective. But as a quality improvement coach, I think that would be a really great opportunity to start sharing about some prioritization tools. So if you're finding that you've scored really low in all 4 categories, it might be a really great opportunity to look at areas that you may be doing really well that you can leverage those sort of successes and see if those successes can translate to helping with improvements in other areas. Or you can also use a tool like Impact Effort Grid, which is a 2x2 square that kind of helps prioritize certain avenues based on whether they would be high or low effort and high and low impact. So if it's a low effort / high impact, otherwise known as like a quick win, that might be an area that you want to just do and maybe prioritize getting that done. Whereas if you're finding that some of these categories that you scored low in are going to take a lot of effort, but not necessarily have a very high impact across the organization, then those are things that you might want to put on the back burner for a little while. So again, all about that prioritization and just taking a really good look and saying, okay, like what are we doing well and how can we leverage that and where can we do a little bit better? Any thoughts on that, Abel?
No, it was great. Yeah, I just wanted to add one more thing in there. I think it's all about the conversation and the discussion as well. So because this tool is about, because previously, let's say you didn't have time or opportunity to look oneself or the organization's data culture, right? So again, within the prioritization aspect, I think it's also more into the conversation, which one we can do this, which one not, as Alex mentioned. So the most important thing is the discussion and the conversation you would have within the team.
Thanks, Abel. We've received a couple other questions, including, maybe Abel, you'd be best to start for this, but where agencies are in terms of assessments. So for example, that there are likely very few agencies that have well-developed policies around data that go beyond privacy. So in your work as a data coach, Abel, what's your sense of how the sector is doing around data policies?
So generally, we did, as I said, previously, we didn't have any formal tool. So I can't have an objective assessment where the organizations are from our experience, but you can see clearly in terms of different capacity, whether in terms of their human aspect or the staff or technology or reports. So there is clear difference, but I don't have clear answer because this is actually our first time to starting to collect this assessment tool.
Bless you, Amy. And in my experience, some of the organizations that I've worked with, it is exactly that. If it's primarily organizations around, when it comes to data, about data retention and data privacy, because those are sort of the minimum standards that we as healthcare providers and health information custodians need to report on. So this is really a starting point to have those conversations around, okay, so in terms of data governance, how do we ensure that we have good quality data? How do we ensure that we as an organization make sure that reports are available and information is available to our staff? So I think there's a lot of work to be done there, and hopefully we're going in the right direction. We also received another question about, again, kind of across the sector, what is our sense of where agencies are in terms of their data cultures? So for example, are we still finding that data is kind of the responsibility of one dedicated resource? Abel, do you want to tackle that one?
So I think the question is, where should we start, right?
Just that and kind of an overall assessment of where the sector is in terms of data culture, if you have any kind of thoughts around that.
Well, it's a little bit difficult to say where the sector is at, but I think in terms of the teams generally, this is a good opportunity. I mean, again, as I said, the discussion and the conversation, that is the main part. And then from there, I think it's good to see your capacity as well, because sometimes what you'd like to do versus what you can do might be a little bit different, right? So I think the conversation might make it clear. And we're there with the organization that we are working with. We're there to support in terms of any advice or practical guidelines as well.
Yeah, thanks, Abel. It is definitely about getting that conversation started. For the organizations that I've worked with in my QI coach capacity, there often is a dedicated person that is kind of responsible for reporting, and those are probably the larger organizations that have those resources available to them. Otherwise, it's something that's often kind of part of somebody's portfolio that often gets pushed to the side of a desk. I am finding that across the sector, management teams and senior leaders, executive directors are very much starting to show a good sense of like data literacy and leveraging data and telling their organization's story through data. But I would love to see that trickle down more to middle management and frontline staff, because again, it's really about seeing that culture across the organization. To which point I'm seeing pop up in the question box, just a tip when it comes to working with staff and getting them thinking about data entry and data quality. An important first step is to ensure staff are thinking of their work as data rather just as recording. And I agree wholeheartedly. It's a completely different conversation when you're asking staff to do something because, like, for that quality assurance piece, for that performance measurement piece, I find it doesn't really resonate. But when you switch the conversation to, okay, how do you know that progress is being made with your client? Like, what sort of measurement are we seeing? And sort of switching the conversation from hunches and anecdotes to really like telling that story through data. I think it really is a good aha moment for a lot of frontline staff. And then one more question regarding the OHT readiness assessments that CMHAs did a couple of months ago, and whether we have a sense of where we are overall in terms of data cultures. So I personally don't have that information. I know that CMHA Ontario is pretty good about collecting information and then sharing it back with those that they collected it from. So I have a feeling that if it hasn't already been shared, it probably will be in the near future. So I can't really speak to that yet. But it does bring up another good point about how to get buy-in and, again, start talking about data culture and building that culture within organizations, that if you're asking staff to, again, like make recordings or to collect data, that in order for them to draw kind of a parallel between the need and the importance of that is to circle back and really provide information back to them on what the findings and conclusions were based on what they shared. The same goes for when we try to get feedback from clients and families, is they're just going to get fatigued from surveys and data collection if they're not seeing the value in it, which really underscores the importance of doing that circle back. And again, if you have the structures in terms of like policies and procedures and processes to guide that circling back, it's really going to be beneficial. Okay, and I think we'll give it another minute for any other questions. Amy and Abel, any other thoughts?
And for me?
No, I'm good. Yeah.
Okay, Amy, I know you've got a few kind of wrapping up slides to do, so if folks want to keep putting questions in the question box in the meantime, you can definitely go through those.
Great. So next slide. We have another webinar coming up on quality improvement readiness assessment. And so in your handout, you will have a link to this registration link. And it's on Thursday, October 31st at 12. Next slide. E-QIP also has quick QI webinars on our YouTube channel. So if you want more understanding or refreshing your knowledge on the model of improvement, there are a bunch of webinars that the QI coaches as well as the data coach have developed. And you also have a link to that in your slides. Next slide. So this is just a list of our webinar series, and you can click on them and it'll take you to our YouTube channel. Next slide. Ideas. So Ideas is improving and driving excellence across sectors, and it's a comprehensive evidence-based quality improvement training program for Ontario's health professionals. So participants become well versed in a common language and approach to quality improvement with the aim to improve patient care, experience, and outcomes. And so we are hosting one on November 18th in Toronto, and if you click on register here, you'll be able to register for this Ideas, which is Foundations of Quality Improvement. Next slide. E-QIP also has a newsletter, so to join our mailing list to stay informed about future webinars and training events, if you click on that link, you can subscribe to our newsletter. Lastly, E-QIP also has a community of practice on Quorum. Quorum is Health Quality Ontario's online platform for connecting health service providers interested in improving care across Ontario. So our community of practice holds resources including tools, templates, webinars, program newsletters, and discussions, and a discussion forum. So in order to sign up, you just have to go onto Quorum, which is at quorum.hqontario.ca, and you could search for E-QIP COP and join our group. And for your information, if you're an organization that uses OCAN, they have transitioned over to version 3.0. So for more information, or if you have any questions, you can directly contact CCIM. And their contact information is on your screen. We will wait for a few more questions, but if you happen to have any questions after this webinar is over, please feel free to contact us. Debbie Bang is our Director of Quality Improvement. Ashley Coster and I are both program managers at E-QIP, so feel free to email us or give us a call.
And I think just a quick note, so the resources that we shared today are available in that online community of practice that Amy just discussed, and you can find all the information about that in the handouts because we've made these slides available to you as well.
Thanks, Alex. Do you have any more questions coming in?
Not that I can see. I think we're probably safe to wrap up.
Okay. So Abel, Alex, and I would like to thank you all for joining the webinar today. We will follow up with an evaluation survey via email, and your feedback is really important to us, so please fill it out. I will also put the link into the chat box if you want to fill it out right now. And that would be greatly appreciated if you could just fill it out before you go. And so thanks again and have a great day.
Thanks all.
Thank you.